Let's talk about perimenopause. What are some symptoms?
I'm not in it. No.
Me neither.
FYI. The things you
I'm
know
not gonna-
or don't know.
I'm not going to admit to it.
Think you know.
So what else? So talk about some things that women, I can say that women feel crazy because their doctors, talk
Well,
about that. Their doctors make them feel crazy.
yeah,
with
they
the
do make them
hormone.
feel crazy. They won't test for it, for starters. No one will test to see if you're in perimenopause.
Right.
And they just brush off their symptoms. Oh, it's anxiety. This is your time in life. That's how, you're in.
I feel like there's like such the gamut because there's also the doctors who will hear some symptoms and automatically say, oh, because of your age, you're in perimenopause. Like, we're not going to test you for it. We're just, that makes sense because of how old you are, instead
Right.
of, like, can we actually see? Can we test? Can we run things? Can we see? Is it that? Is it my thyroid? Is it something else? Right? And I feel like it's like this Band-Aid now to be like, oh, you're 40. It's perimenopause.
Or here's an anti-anxiety medication or an antidepressant.
Yes.
So,
I actually personally got told that it's my age, like why I'm tired, why I'm fatigued, why I'm not sleeping well. That just comes with being in your 40s.
well, it does, but there's something you can do about it.
Exactly.
You don't have to.
We don't have to suffer.
Yes.
Like,
Yeah.
I feel like that's the big, like, it's such a huge conversation to have because that is what it's the message in general, not just from doctors. It's the message in general that, like, with age, we're supposed to feel like crap.
Yeah.
Like, that's just part of it.
That's it.
Like, and it's so untrue. Yeah.
And they
So-
don't talk about natural things that you can do to help with your symptoms. Strength training, getting the sleep, and then ways to get the sleep. I mean, if you have young kids running around and a job and social obligations, oh, we'll get some rest. Well, how do I do that?
Right. Sleep hygiene practices, like actually having conversations about what that looks like, tools you can use that you can actually not start becoming dependent on all of the things that, like, you turn to. You're going to turn to the Tylenol PM. You're going to turn to the things that you can buy at CVS because you think that's going to help you. You know, if you just don't know any better. And sleep is, I tell all of our clients, like, sleep is the first domino.
Yes.
When sleep falls, they all fall.
That's true.
You know, and sleep is one of the very first signs we can see that we do need to test your hormones. We do need to see what's going on. Like, it's not natural for us to be just walking around relying on caffeine and exhausted all the time.
Right.
That's a sign of something, and we need to dig deeper and figure out what that is.
And the sign is low progesterone, which they won't test for. And progesterone is the number one thing we can start replacing, even if you're still cycling, that will improve sleep.
Right.
And then you'll have energy when you wake up to go to the gym to build your muscles so you can get better sleep.
Yeah.
And progesterone is not a pharmaceutical. You can stay on it forever.
Right.
So
What's progesterone?
progesterone is one of our reproductive hormones, and it helps regulate mood. It helps regulate sleep, stress, and anxiety. And yeah, we know.
Like, the peanut gallery just comment. That's what I am on the Men on Biotropic podcast. I'm sitting there going, what did you just say? What did he say?
No,
Listen.
let's talk about husbands.
We are pains in the ass.
This is
We
true.
need our own hormones, so everybody needs their own, everybody has their own thing.
It's true.
This is true.
So the progesterone. So say it again, I'm sorry.
So progesterone is one of our reproductive hormones. It helps regulate sleep and mood, anxiety. And that's the first thing that starts to drop. As we're getting closer in our 40s, closer to 45, the progesterone starts to go lower. Even if you're still having regular cycles, your progesterone is low, and that's something that you can easily replace. It's usually in a pill. It's safe, it's protective against cancer, and it helps regulate the hormones and put things in balance. Because we usually start having the sleep issues when you're having an estrogen dominance issue. Progesterone's low. Take your progesterone. You can take it with your cycle. You can take it in the first part of your cycle, the last part of your cycle, or you can take it all the time. So it just depends on how bad your symptoms are and what your cycles are like.
But I think one of the things that are really important is not just understanding, having someone run that test and finding out where your level is, but having someone wise enough to give you personalized service,
Right.
to actually be able to see what if it's high. So I'm someone who mine is high, right? And so it's an abnormality that had been missed in my case in the past, right? But be able to have that individualized service as somebody like you to be able to say, no, like this is high, and these are the things we can do to lower it, right? I think that's just what's so important is being able to recognize these things, to be able to test for these things,
Right.
and then to be able to counsel and coach through how we can handle these things is
And
so important.
it's a part of the puzzle. So it's not just
It's really
treating
what it is, right?
Yes.
Like it's such a big
Yeah.
puzzle. Like, welcome to being a woman.
Yes.
Or a human in general, right? I know, exactly.
Difficult puzzles to keep putting back together.
Exactly.
Yeah.
Right? But like putting those pieces together and because there are so many moving parts.
Yes.
And, you know, there specifically like when it comes to these type of things, having different levels. Like you could probably speak to that and the fact that there is what maybe the world or whoever the powers that be are that consider what low is or deficient is, but then there's what's optimal and what's not optimal.
And that's individual because mine can be low, but my sleep doesn't happen to be affected.
Right.
So it doesn't have to, if you're not having symptoms, you don't have to do anything about
Right.
it. But if you are, there are options, you know, balancing. So, and it's a constant moving machine. So even once we replace the progesterone, for example, we still have to monitor it because then you're going to overshoot your landing. We have to bring it back.
Yeah.
You know, and then also supplementing with lifestyle.
Exactly. Like that was one of the learning things for me. I'm a runner, so I run, and it's actually like that was such a great, first of all, really confident booster. And then Melanie was like, "Your running is probably what's keeping you in balance." You know, is because of the fact that like the aerobic activity.
Exactly.
Oh, my frequency is getting in the way. It's a little big. Like there are just so many things and you don't know what you don't know, and so being able to talk to an educated professional about these things and to learn, you know, you just learn so much about yourself as you're starting to take on these things. It's so much more than hormones. I feel like that's the thing, right? Isn't that the general conversation? It's so much more than hormones. We could talk about the specific hormones, but it is the puzzle, and who do you have in your life that's helping you put those pieces together?
Yeah, and there's so many moving parts, like you said, and everything is connected. So your thyroid has to be regulated, so your other hormones can be regulated, and vice versa. You know?
Yeah.
So
Like they're not in isolation of each other.
Exactly.
Exactly.
Yeah.
So true.
So what are some of the myths that these women think is because of their age, but it's their hormones? Can you think of anything?
Well, the anxiety.
Let's dig into that.
Yes. So when your hormones are not balanced, nothing is balanced. You know, your emotions, your what is it called? Where you are hot and cold. What are we? Mood swings is the word I was looking for.
Yeah.
You know.
Yes, hot flashes,
Memory,
mood
cognition.
swings. Exactly.
You know, so-
it all just plays in such a big part. But you know, understanding our gut, understanding the thyroid, understanding that it is this entire axis happening, and if there's a broken piece in the chain, then the whole system is off, right? And our serotonin is mostly housed in our gut. You know, all of the things that will help to turn off our fight or flight is housed in our gut. That's where like the health coaching part, this is where I get the most excited, is because of the fact that, you know, a lot of people don't understand that when your body is in fight or flight, when you are in chronic stress, where you're feeling that high anxiety, you cannot digest food. Your body physically does not digest. It turns there are two different systems, and that system is turned off so that the other system can help protect you from the bear.
Right.
Right?
Exactly.
Your body's
Yes.
like the bear.
Yep.
There's a bear. That's the only reason why she's acting this way is
Right.
there's a bear, and so you don't digest food. There's no calm, right? And so then we begin. Okay, so your microbiome is off, and now your gut health is off, and now your ability to produce serotonin is off, and your cognition is off, and the communication between your brain and your stomach is like everything starts. You see how it starts to break down, but women are told you're just getting older.
And anxiety is like the first. Oh, you're anxious. You're
Yeah,
it's just
fine.
anxiety.
It's just,
you know?
it's
Yes.
part of it. You're a mom. You're supposed to be anxious. You know, it's
Right.
like you're always looking for like these other reasons instead of like, no, it's actually internal.
And then what you said about the gut, that's so important because now you're anxious, you're not sleeping, You're not digesting your food, so you're gaining weight. You're holding
Right.
on to every calorie
Which
because
is
you're
another thing.
weight gain.
Weight gain.
Yes. Yeah.
Right? That's why. You're just supposed to be 20 pounds heavier.
Right.
Right? It comes with menopause. And it's so untrue.
It's untrue.
Yeah, it's so untrue.
And the gut is so important. And we've moved away as a society from using exercise and diet as treatment plans.
Right.
We have an antidepressant for you to
Right.
calm your anxiety. Not like what are you eating? Are you eating processed foods? Are you taking time out for yourself? And I even tell my patients too, like even if you only have 1 minute or 30 seconds to take a time out for yourself because you need that calm, you need a second to regroup, it will bring that anxiety down. And then we grow from there. Like now take 2 minutes after you've done that, you grow those routines.
Right.
It will calm your gut, your anxiety. It helps regulate your hormones. You could do this naturally. Like we don't have to replace the hormones, but because of our lifestyle
Right.
and our diet, and then we're you know, advanced enough. Thankfully, we have these tools
To have
that
the
we can
supports. Yeah.
do hormone replacement. You know,
Yeah.
we have these advancements. So
Yeah.
anxiety, weight gain, sleep. What else are some things that we all complain about? The mood swings, depression,
Yeah.
energy.
Oh, the energy. I feel energy is definitely one of those big, which it all just, you see how it all just keeps coming back. It all just,
All
we're like, yes, but
connected.
that's because of all
Yes,
of this.
it's
and,
all connected.
You know, and people don't realize, especially those who are like maybe drinking coffee nonstop, or like, I needed an IV, and realizing that the coffee's not actually doing anything for you. That's one of the very first signs that if you can put a stimulant in your body and it's not making you feel anything, the whole system's off.
Right.
So that's a sign. That's something that we know, okay, so that we need to address. The whole system is off. And there's help for that, you know, and I think energy is just one of those. If you don't wake up in the morning feeling like you slept last night, you have an energy deficiency.
Yes.
Like for sure.
Yeah.
No, absolutely.
And it usually stems back to hormone imbalance and, and your
See
gut.
that? Exactly. Exactly. Truly. So true. Where'd our moderator?
know.
Moderator left us.
So we talked about progesterone. We talked about balancing it with estrogen a little bit. And a big thing is cancer. Everybody's afraid that the hormones are going to either cause cancer or bring it back, you know, bring you out of remission.
Right. I feel like that was the message for a long time, was that having these, I think there's a confusion about what the hormones are, like the replacement is, you know, and whether it's this like medication, you know what I'm saying, or pharmaceutical thing that we're putting in our body, and we're on this drug for the rest of our life. Like, can you explain like the difference between?
And there are different formulations. The micronized progesterone has been proven to be the safest in an oral form. The estrogen, it's estradiol. I like to use the patch because the absorption is the safest, and it's been proven with research that it is protective against cancer, protective against osteoporosis. And if you think about it, most cancers, a lot of women are getting cancer diagnosis after menopause. And also, another point to bring up is when you're pregnant, your estrogen levels are the highest.
Right.
Not very many people get diagnosed with breast cancer during
they're pregnant.
pregnancy.
Right.
And if it was strictly estrogen, then every pregnant woman would
Right.
be diagnosed with breast cancer.
So true.
So there are, you know, there are details and nuances in different types of cancers, but for the most part, the estradiol, the progesterone, they are cancer protective. We had that really horrible study in the early 2000s, the Women's Health Initiative, and they were using progestin, and they were using a synthetic estrogen. And they were taking women who were postmenopausal, who had been postmenopausal for more than 10 years. So they hadn't been exposed to estrogen for
And then
decades.
reintroducing a synthetic
Then
version.
reintroducing, not only that, but they're postmenopausal, so they were already high for cardiovascular disease risk, stroke, and a lot of them had cardiovascular disease. They had high blood pressure, so their risks for events was high to begin with, and this was the pool of people that they.
Explain the difference between what we give them and synthetic.
Okay, so what we give them, estradiol, is replacing your own estradiol, and the same with the progesterone. These are not synthetics. They match the hormones that we have already, so we're just putting back things that are already in our bodies.
Why are we done? I think that's so important. Yeah.
Yeah.
You know what we should talk about? Let's talk about women and testosterone.
Yes, that was the.
That's important.
Yes,
That-
it is.
Thank you.
So talk about too, the different ways to,
To take testosterone?
take it,
For testosterone?
For women, yeah.
Well, just like men think, or
the dosage.
people in general, not just men, think that estradiol is a female hormone. We tend to relate testosterone to men being a
Right.
male hormone, and
Right.
that's not the case. All of us have all of those hormones. Testosterone helps improve libido, it helps improve muscle mass, muscle definition, energy, motivation, but to the point where you still have to put in the work. So I like to tell my patients when we do start you on testosterone, if you've ever seen the old Willy Wonka movie, like you're not going to jump out of bed like Grandpa on Willy Wonka
I'm
because
fixed.
you have testosterone.
Right.
You still have to get up. You still have to put in the work. You have to exercise. And once you're there at the gym, you're going to get more productivity out of your baseline workout, more muscle definition out of your baseline workout without having to increase weights, frequency, or time at the gym. And you're going to have more energy.
Right.
So then eventually you do have to increase to continue to see the gains. But initially, starting the testosterone is going to bring your baseline workout to like another level. And then for women, mostly I like to start them on a testosterone cream, but you do have an option of testosterone injections as well. So
So the creams that we have too, you can also make it to where the creams include progesterone.
we can
So
do
it's
combination
all
creams
in
with the
administration.
bioidenticals, yes.
That's pretty awesome.
And tailor it. With the creams, it's tough if you have like young children because you can transfer that, especially if
Oh.
you're picking them up all the time, and you
Yeah.
know. So you put it in a place where you wouldn't be transferring it, and then you know you have to wait a certain amount of time for it to absorb before you get dressed and things like that. Washing your hands. So sometimes it can be a little cumbersome. So a lot of people like the injections more, but both are beneficial.
And so besides libido, which is I feel like one of the biggest that sure signs
Yes.
to address to test testosterone. What are some other signs that you may be low on testosterone as a woman?
Fatigue during the day, and energy and motivation. Libido is usually the biggest thing.
And do you generally, when you do testing, you do them all?
Yes.
You're like, let's test, let's see.
Yes, we look at the FSH and the LH to see if you're peri, post, menopausal. We look at the estradiol, the progesterone, the testosterone levels. We look at the thyroid because it's all connected. And then we look at also your complete blood count. Is your fatigue related to anemia? Maybe.
Right.
And so we fix the anemia, but you're still tired. Okay, well now we need to address the progesterone and the estradiol.
Yeah.
Also, there's been some incidences where when you first start testosterone, you can raise your cholesterol a little bit. So we like to monitor that. Usually it levels out after you've been on it for a little while. So we look at all of that.
How important is testosterone for women with sleep?
Not very.
Not like men?
No. Testosterone usually doesn't have an impact on sleep. But in a roundabout way, when you have more energy to work out at the gym and you're building more muscle, you get better sleep. So it does have an impact, but it's not usually like the first thing we'll put our women on for sleep.
Right.
Bone protection, because you're building your muscles.
The hormone for women, is that more progesterone?
Progesterone, and if that still doesn't work, then we add the estradiol, depending on, you know, postmenopausal, if you have a uterus, so just individualized. And that's why it's important to meet with your medical professional with a medical history, the drugs that you're taking.
And to continue having care. I feel like I've spoken to so many women who maybe were put on hormone replacement, some without even testing, but that's a whole other conversation. Just based on their symptoms, were put on a random dose of hormone replacement, but then don't get tested again. Like, how often do you feel someone should have their blood test run?
Well, initially starting, and you can go based on, it's a combination of the symptoms and the labs, but you really should have both. Initially, when you're starting any new medication, whether it's blood pressure medication or hormone replacement, you should have your labs checked in 3 months. That's usually enough time to see a difference, whether it's going to be helping, whether it's going to affect your labs. You need to check it again in 3 months. Also, did we give you too much? And, you know, now you're
it's
not
the
sleeping,
other
but
way.
you cry all the time. You know,
Right.
so we need to figure
Right.
that out as well. Being on testosterone can cause darker hair growth in some areas. So we want to make sure we're not overshooting our landing and we're decreasing side effects as much as possible.
I think it's so important to have that. And we can talk a little bit about the men's side of things too, because this conversation, as far as like our men clients are concerned, that, you know, we have clients who come to us, may have been put on testosterone and did not actually have their estrogen tested.
Right.
So they've been on testosterone and they have high levels of estrogen and no one ever tested it or suppressed it. And they are the ones who are crying.
They are the ones that are crying. Right. So we need to check levels every 3 months. Once things are stabilized, you can spread it out when you're not seeing a lot of changes and a lot of side effects to 6 months, 9 months, once a year, but every 3 months until things are pretty stabilized. And then also there's the other side of the estradiol if we suppressed it too much and now we've taken away the cardio protection. So men and women have to have an optimized level of estradiol, testosterone.
And monitoring support.
Yes.
Having that personalized care
Yes.
is so important.
It's so important.
So important.
And then along with, you know, mentioned that testosterone can slightly raise some cholesterol sometimes. So are you on an omega? And also, did you know that omega-3s can help your body absorb the testosterone replacement and utilize it more efficiently? So you're getting more benefits out of having the testosterone with an omega.
Learned something today. It's true, but I feel like that's why we have so many different components of care, so that we can have those kind of conversations. And it's just not the kind of service that's provided anywhere else. You're not going to get that somewhere. That someone's actually having all of these different conversations. You know, it's not just about the replacements. It's not just about the supplements, just about the lifestyle. It is, again, putting all of the solution puzzle pieces together in order to be able to give you the best experience. You know, we all deserve to feel good.
It's true. And we are taking these medications too. We're on hormone replacement.
Exactly.
We're testing our levels. So
Exactly.
we're in it with you.
What is that? Wait, what's that commercial? I'm not just the owner
Oh,
of
yeah,
the
not
hair
just
care for men.
I'm also a client.
I'm also a client.
Exactly. So this is, you're pulling off of our passion for healthy lifestyle. We want to have longevity ourselves.
Right.
And have you ever been in a doctor's office with a really unhealthy doctor giving you health advice?
Oh, yeah. Oh, yeah,
Yeah.
absolutely.
So
Absolutely. Absolutely.
that's not us. Like,
Exactly.
I like to run. I know there's days when I have to slow down my running and I up my strength training. There's days when I don't feel like going. So I understand the
Yeah.
pitfalls and the hurdles, and we're going through this too.
I think that,
Yeah.
and we share that experience,
Yeah.
and we bring our own experiences to the table, our knowledge, our expertise. But it means that you're just not alone. And I know that so many times, and most people, you're at home by yourself trying to figure this all out.
Right.
You know, and like you're going to this doctor and that doctor and this doctor, and sometimes you don't even know which doctor you're supposed to go to, because you're like, I don't know what doctor handles this.
Right.
Right.
Yes.
And then you may go to the doctor, you may get some sort of solution, and then you're just left on your own to go try to figure that out. And I think the fact that there's no figuring it out, like in my own experience, I know that I need that to be able to, can I ask a question? You know, I have
Everybody
a question.
does.
You
That's
know?
normal. Yes,
Exactly. And do I
exactly.
need to schedule an appointment and, you know, pay $600 so I could come ask you a simple question? And here, being able to have the support and care is going to be so life-changing for so many people, for sure. Absolutely.
Yes.
You guys good?
Yeah.
Good to hear.
I'm like, where's the voice coming from?